Have you ever wondered what really happens inside your body during sexual arousal? What triggers that rush of heat, the rapid heartbeat, and the overwhelming sensation of pleasure? Is it all just in your head, or is there something much deeper happening beneath the surface? In reality, sexual arousal is far more than just a fleeting feeling. It's a highly coordinated biological process, orchestrated by your brain, nerves, blood vessels, and hormones. Your body prepares itself in ways you may not even realize, from the release of powerful chemicals that heighten pleasure to the expansion of blood vessels that intensify sensitivity. But what happens when this process is interrupted? Could it have unexpected effects on your body? In this video, we'll explore white heavy checkmark, the science behind sexual arousal, how your brain, heart, and reproductive system work together to create pleasure. White heavy checkmark, the hidden effects of arousal on your body, including the role of hormones like testosterone and oxytocin. White heavy checkmark, why testicular discomfort, often called blue balls, occurs and whether it's something to be concerned about. White heavy checkmark, the potential risks of prolonged arousal without release, and how your body naturally resolves the issue. White heavy checkmark, when testicular pain is a warning sign of something more serious, and when you should seek medical help. By the end of this video, you'll have a deeper understanding of your own body, helping you make informed decisions about your sexual health and well-being. Don't miss out. Stay with us until the end to uncover the fascinating science behind human intimacy. If you haven't subscribed to our channel yet, I encourage you to click the subscribe button and ring the notification bell to stay updated on all our latest content. I'm eager to hear your thoughts on today's topic. If you enjoy the content, please comment 1 below. If it doesn't resonate with you, leave a 0. Your feedback is crucial as it helps me create better videos that align with your interests. Now, let's get started. What happens in your body during sexual arousal? Sexual arousal is a profound and intricate experience, involving a complex interplay of psychological, neurological, and physiological responses. It is not merely a fleeting moment of desire but an entire biological symphony, in which the body prepares itself for intimacy, orchestrating a cascade of changes that heighten sensation, intensify pleasure, and prime the body for climax. For men, the first spark of arousal often begins in the brain, triggered by visual stimuli, physical touch, emotional connection, or even mental imagery. The brain, acting as the command center, sends powerful signals through the nervous system, prompting the release of nitric oxide, a potent vasodilator that causes the blood vessels to expand. This is the catalyst for an intense physical transformation, as increased blood flow rushes toward the pelvic region, particularly the penis and testicles. This process, known as vasocongestion, is what causes the penis to become firm and erect. The spongy erectile tissues, known as the corpora cavernosa, fill with blood, creating the rigidity necessary for penetration. But beyond this obvious external sign of arousal, there are countless other physiological reactions occurring simultaneously. The testicles, too, become engorged, growing slightly in size due to the increased blood supply. They often pull closer to the body, a response controlled by the cremaster muscle, which contracts to regulate temperature and enhance sensitivity. The scrotum tightens, and the skin in the genital area may darken due to the surge in circulation. Internally, the prostate gland and seminal vesicles begin producing seminal fluid, preparing for the potential release of sperm. Beyond the genitals, the entire body reacts to arousal in subtle yet powerful ways. Heart rate increases, breathing becomes shallow and rapid, and body temperature rises slightly. The skin may become more sensitive to touch, and in some cases, a light flush may spread across the chest and neck, a phenomenon known as the sex flush, caused by increased blood flow near the surface of the skin. But while all these changes create a pleasurable buildup, there is a downside to prolonged arousal without release. Why do the testicles hurt? To fully grasp why testicular discomfort occurs, imagine a highway filled with rushing cars, each vehicle representing a surge of blood racing toward the genitals during arousal. Normally, this blood flow is carefully regulated, arriving in bursts and then dissipating once stimulation subsides or orgasm is achieved. However, when this natural cycle is interrupted, when arousal remains high but no release occurs, the blood becomes trapped in the genitals, leading to a condition known as testicular congestion, commonly referred to as blue balls. If you are still watching this video and find these lessons useful, please comment number 1 below to let me know that you are still watching this video with me. This congestion creates a sensation of heaviness, aching, or even a dull throbbing pain in the testicles. The discomfort is due to the temporary pooling of blood, which stretches the sensitive tissues and increases pressure inside the scrotum. Some men describe this as a deep ache, while others report a feeling of tightness, warmth, or heightened sensitivity that extends into the lower abdomen or even the thighs. The experience is often more intense following prolonged stimulation, such as extended foreplay or frequent masturbation without orgasm. The longer the body remains in a state of heightened arousal without release, the more pronounced the sensation can become. This can be frustrating, distracting, and even uncomfortable, but it is important to remember that it is not dangerous. Although this discomfort can sometimes linger, it gradually fades as the body naturally reabsorbs the excess blood and redirects circulation back to normal levels. The time it takes for this to resolve varies from person to person, but in most cases, the ache disappears within 30 minutes to a few hours. Engaging in light physical activity, such as walking, stretching, or even taking a cold shower, can help accelerate the process. Mental distraction, such as focusing on a different task or shifting one's thoughts away from sexual stimulation, can also help reduce the lingering effects. Interestingly, not all men experience testicular congestion to the same degree. Some may never feel it at all, while others may find it particularly bothersome. It depends on individual sensitivity, blood circulation efficiency, and the intensity of arousal. In some rare cases, men who frequently suppress their arousal or repeatedly engage in extended stimulation without release may experience chronic discomfort. While this is not harmful, it can be frustrating and may interfere with one's ability to concentrate or relax. Despite the temporary annoyance, testicular congestion is simply a natural response to an interrupted cycle of pleasure. It is a testament to how powerfully interconnected the brain, body, and emotions are when it comes to human intimacy. The body is designed to return to equilibrium, and whether through orgasm or time, the discomfort always subsides naturally. The bigger picture, understanding arousal and release. While many focus solely on the physical sensations of arousal, it is essential to recognize that sexual excitement is as much an emotional and mental experience as it is a biological one. The body's response to arousal is deeply tied to desire, attraction, connection, and even stress levels. Emotional factors such as anticipation, frustration, or unresolved tension can sometimes heighten or prolong the effects of arousal, making sensations feel more intense. In some cases, prolonged testicular discomfort may also be linked to factors beyond just sexual arousal. Stress, anxiety, and certain medical conditions can sometimes mimic the sensations of testicular congestion. If discomfort persists long after arousal has ended, or if it becomes a recurring issue unrelated to sexual activity, it may be worth discussing with a healthcare provider to rule out any underlying concerns. Understanding the body's natural cycles of arousal and release can lead to greater self-awareness and sexual well-being. Recognizing what is happening internally removes fear and confusion, allowing for a more comfortable, fulfilling experience of intimacy. Whether one chooses to reach climax or simply allow the body to return to balance on its own, the most important thing is to listen to what the body is communicating and respond in a way that feels best. At its core, sexuality is a deeply personal and profound aspect of the human experience. It is more than just an act. It is an intricate, interconnected process that speaks to our biology, emotions, and even our sense of connection to ourselves and others. So the next time you find yourself experiencing the unmistakable signs of arousal, remember, it's not just a fleeting moment of passion. It's your body's way of preparing for pleasure, connection, and an intricate dance of physiological wonders, one that is as fascinating as it is deeply human. When should you be concerned? For most men, testicular discomfort caused by congestion is temporary, harmless, and resolves on its own. However, There are instances where persistent or severe testicular pain could be a warning sign of something far more serious. Think of testicular pain as a messenger. Most of the time, it delivers benign news, signaling nothing more than the temporary effects of arousal. But sometimes, that messenger brings an urgent warning that should never be ignored. Understanding when pain is normal and when it could be a sign of something more concerning is crucial for protecting your long-term health and well-being. So, when should you pay close attention and seek medical help? If the pain is persistent, severe, or accompanied by other symptoms such as swelling, fever, nausea, or abnormal discharge, it may indicate an underlying medical condition that requires urgent attention. Epididymitis, the silent intruder. One of the most common medical causes of prolonged testicular pain is epididymitis, an inflammation of the epididymis, a tightly coiled tube located at the back of the testicle that plays a vital role in storing and transporting sperm. When the epididymis becomes inflamed, it can cause a persistent aching, pulling, or throbbing pain in the testicles. Unlike the dull discomfort of testicular congestion, which comes and goes, epididymitis pain lingers and often worsens over time. This condition is usually caused by bacterial infections, which may stem from a urinary tract infection, UTI, an enlarged prostate, or even a sexually transmitted infection, STI, such as chlamydia or gonorrhea. Other symptoms to watch for include swelling or redness in the scrotum, a feeling of warmth or tenderness in one or both testicles, painful urination or an urgent need to urinate, cloudy or foul-smelling urine, fever and chills, unusual discharge from the penis. If you notice any of these warning signs, do not ignore them. Epididymitis can worsen if left untreated, potentially leading to complications such as abscess formation, chronic pain, or even infertility. Seeking medical attention early can prevent these serious outcomes, and treatment typically includes antibiotics, pain relievers, and supportive care to reduce inflammation. Orchitis, the testicular inflammation that can strike unexpectedly. Another potential culprit behind testicular pain is orchitis, a condition in which one or both testicles become inflamed. Unlike epididymitis, which affects the sperm-storing tubes, orchitis directly targets the testicular tissue itself, making it particularly painful and distressing. The most common cause of orchitis is viral infection, with the mumps virus being a notorious culprit. While mumps primarily affects children, it can strike adult men as well, especially those who were not vaccinated in childhood. Symptoms of orchitis include intense testicular pain and tenderness, swelling and redness in the scrotum, fever and body aches, a sensation of heaviness in the groin, fatigue and overall malaise. Though less common in older adults, orchitis should never be dismissed as harmless, as prolonged inflammation can negatively impact fertility and testosterone production. If you experience symptoms, it is essential to consult a doctor to determine whether antiviral medication, pain management, or other interventions are necessary. If you are still watching this video and find these lessons useful, please comment number 2 below to let me know that you are still watching this video with me. Testicular torsion, a medical emergency that cannot wait. Of all the potential causes of severe testicular pain, testicular torsion is by far the most urgent and life-threatening. Unlike infections, which develop gradually, testicular torsion happens suddenly and without warning. This condition occurs when the spermatic cord twists, cutting off blood flow to the affected testicle. Without oxygen-rich blood, the testicular tissue begins to die rapidly, making it a true medical emergency that requires immediate intervention. Signs of testicular torsion: sudden, excruciating pain in one testicle, swelling and significant tenderness in the scrotum, a testicle that appears abnormally high or twisted, nausea and vomiting due to severe pain, difficulty walking or standing due to discomfort. If you suspect testicular torsion, do not hesitate. Seek emergency medical attention immediately. The window for saving the testicle is small. Ideally, surgical intervention should occur within 6 hours of symptom onset to prevent permanent damage or loss of the testicle. Delaying treatment increases the risk of infertility and other serious complications. Other possible causes of testicular pain. While epididymitis, orchitis, and testicular torsion are some of the most common serious causes of testicular pain, other conditions may also be at play. Varicocele, enlarged veins in the scrotum, similar to varicose veins, that can cause dull, aching discomfort. Hydrocele, a buildup of fluid around the testicle that may lead to swelling and mild pain. Hernia, an inguinal hernia, where part of the intestine pushes into the groin, can sometimes cause pain near the testicles. Kidney stones, pain from kidney stones can radiate to the testicles, mimicking direct testicular pain. Nerve damage, conditions like diabetes or chronic nerve compression can cause unexplained testicular discomfort. When to see a doctor? Testicular pain should never be ignored, especially when it is severe, persistent, or accompanied by other concerning symptoms. Seek immediate medical attention if you experience sudden, intense testicular pain that does not improve, swelling, redness, or warmth in the scrotum, fever, nausea, or vomiting, painful urination or unusual discharge, a visibly twisted, high-riding, or misshapen testicle. While mild discomfort from testicular congestion is normal and temporary, persistent pain should always be taken seriously. Your testicles are essential not just for reproduction but for overall hormonal balance and well-being. Protecting them means safeguarding your long-term health. Being proactive, recognizing the warning signs, and seeking medical attention when needed can prevent serious complications and ensure optimal sexual and reproductive health. So, the next time you experience testicular pain, listen to your body. It may be trying to tell you something important. Varicocele and other possible causes of testicular pain. While some cases of testicular discomfort are short-lived and harmless, other conditions may be lurking beneath the surface, subtly affecting your health in ways you may not immediately recognize. One such condition is varicocele, a relatively common but often overlooked cause of testicular discomfort. A varicocele occurs when the veins inside the scrotum become abnormally enlarged, similar to varicose veins that develop in the legs. These swollen veins can interfere with proper blood circulation, leading to a feeling of heaviness, dull aching pain, or increased warmth in the scrotal area. Interestingly, while some men with varicocele experience no symptoms at all, others may notice that discomfort worsens after prolonged standing or physical activity, following sexual arousal or ejaculation, during hot weather, as heat can dilate the veins even further. Varicocele is also one of the leading causes of male infertility, as the excess blood pooling in the testicles can raise scrotal temperature, negatively impacting sperm production. However, the good news is that if varicocele is responsible for testicular pain, there are highly effective treatments available. In mild cases, simple lifestyle adjustments, such as wearing supportive underwear or avoiding prolonged standing, can help. In more severe cases, surgical procedures like varicocelectomy or embolization can permanently correct the issue, restoring normal blood flow and eliminating discomfort. Hernias and other underlying health problems. Another possible but often unexpected culprit behind testicular pain is an inguinal hernia. This condition occurs when a section of the intestine or abdominal tissue pushes through a weak spot in the lower abdominal wall, sometimes extending into the scrotum and putting direct pressure on the testicular area. This can result in a persistent, dragging pain, especially when engaging in activities that increase intra-abdominal pressure, such as lifting heavy objects, straining during bowel movements, intense physical exertion, including exercise or sexual activity. Men with inguinal hernias may also notice a bulge or swelling near the groin that becomes more pronounced when standing or coughing. If left untreated, hernias can worsen, leading to serious complications such as intestinal blockage or strangulation, where the blood supply to the protruding intestine is cut off. If you suspect that a hernia is causing your testicular pain, it is essential to consult a doctor, as surgical intervention may be necessary to prevent further complications. Other potential causes of testicular discomfort that should not be overlooked include Nerve compression or damage. Chronic nerve conditions, diabetes, or past injuries can lead to unexplained scrotal pain. Prostatitis, inflammation of the prostate, can sometimes cause referred pain in the testicles. Kidney stones. A stone passing through the ureter can create radiating pain that mimics testicular discomfort. Pelvic floor dysfunction. Tightness or muscle spasms in the pelvic region can cause aching sensations in the groin and scrotum. If you are still watching this video and find these lessons useful, please comment number 3 below to let me know that you are still watching this video with me. What to do if you experience testicular pain after masturbation. If you experience testicular pain after masturbation, it's natural to feel concerned, but in most cases, the discomfort is temporary and harmless. Testicular congestion, also known as blue balls, is one of the most common causes and will usually resolve on its own. However, if the pain lingers for an extended period or feels unusually intense, you'll want to take proactive steps to find relief. Here's what you can do to alleviate testicular discomfort. White heavy check mark. Stay calm and relax. Mild pain is rarely a cause for alarm and will likely subside within a few hours. Stress can sometimes make the sensation feel worse, so focus on staying relaxed and patient. White heavy check mark. Take a break from sexual activity. Give your body time to recover by avoiding masturbation and sexual stimulation for at least a couple of days. This allows the blood flow to normalize and the congestion to resolve naturally. White heavy check mark. Apply a cold compress. Wrapping a cold pack or ice pack in a clean cloth and applying it to the testicular area for 15 minutes can help reduce inflammation, numb the pain, and calm irritated nerve endings. White heavy check mark. Wear supportive underwear. A snug but comfortable pair of briefs or a jockstrap can help relieve strain on the testicles, providing support and preventing unnecessary movement that could worsen discomfort. White heavy check mark. Engage in light physical activity. Taking a short walk or engaging in gentle stretching can help redirect blood circulation away from the genitals, speeding up the recovery process. White heavy check mark. Hydrate and avoid caffeine. Staying hydrated helps promote better circulation and muscle relaxation, reducing lingering tension in the pelvic region. Avoid caffeine and alcohol, as they can sometimes increase sensitivity and prolong discomfort. When to see a doctor. While occasional testicular discomfort after masturbation is normal, persistent or severe pain should not be ignored. You should seek medical evaluation if. Warning: the pain lasts longer than 48 to 72 hours without improvement. Warning: the pain is intense, sharp, or progressively worsening. Warning: you experience swelling, redness, or warmth in the testicles. Warning: the pain is accompanied by fever, nausea, or vomiting. Warning: you notice abnormal penile discharge or painful urination. Warning: there is a visible bulge in the groin, which may indicate a hernia. A urologist can perform a thorough examination, including ultrasound imaging or urine tests, to determine whether an infection, structural issue, or other medical condition is the underlying cause. Remember, testicular health is vital not just for reproductive function, but for overall well-being. Addressing discomfort early prevents complications and ensures long-term comfort and vitality. So, listen to your body, recognize the warning signs, and don't hesitate to seek professional medical advice if something feels off. Your health is always worth prioritizing. Now that we've explored the fascinating science behind sexual arousal, the effects on your body, and the potential risks of prolonged arousal without release, what have you learned today? Did anything surprise you? We'd love to hear from you. Comment below and share one thing you've learned from this video that you'll bring into practice in your own life. Whether it's understanding the role of your brain in arousal, knowing how to relieve testicular discomfort, or recognizing when pain might be a sign of something more serious, your insights could help others, too. And if you found this video valuable, don't forget to like, share, and subscribe to our YouTube channel. Your support helps us continue creating informative content to keep you healthy, informed, and confident in your well-being. Thanks for watching, and we'll see you in the next video.